Welcome to the KN Education YouTube channel. In this video, we will discuss about how to write the liver diagram and the biliary tree. Okay. So first and foremost, we will see the sketch. This is the right lobe. Okay. What is this? This is the right lobe of the liver. Okay. And this one is the left lobe of the liver. Clear? Okay. So these two were joined by which one? That is, this one is the, what is this? The name is this ligament which makes the joining of two lobes, that is ligament of falciparum. Okay, falciform. Clear? Next. So another one which is present in the beneath of the falciparum ligament, that is the round ligament, or we can call it as a, so it is a ligament teres. What do you call? We can call it as ligament of teres. So I will write the names afterwards. First you understand how to write. Okay, later on. So we need to write the some other ligaments which are present in the superiorly. Okay, so this one which is having the, okay, so the crown type which joins the, the crown type which joins the diaphragm, so that one will be said as coronary ligament. Okay, so it is a crown type which the ligament which attaches the diaphragm. So this one is the what? Diaphragm. Clear? Okay, so it will continues up to the spleen also. Now, so this diaphragm and the liver, so inferior surface, this is the inferior surface of the diaphragm. So inferior surface of the diaphragm is attached by the, so from the liver, from the upper surface of the liver to the inferior surface of the diaphragm is attached by a ligament called coronary ligament. Clear? And this one is the falciform ligament, this one is the round ligament called ligament of teres. So this ligament of teres is a remnant of the fetal umbilicus. Okay, fetal umbilicus vein will be there now. So fetal umbilicus vein, that is the remnant. Clear? So right lobe, left lobe. So we have discussed this one. Now about the portal vein, this is the what? So I will take it as a black color. This is the portal vein. Next, and I will write another one, that is hepatic vein, hepatic artery. This is the hepatic artery. This one is the portal vein. Okay. Now, so portal vein, it will carries from where? It will carries the vein from the, okay, it will carries from the stomach also. Okay, it will carries from the stomach also, it will carries from the spleen. Okay, it will carries from the spleen also, and it will carries from where? It will carries from the intestine also. So this one will takes this one will be called as mesenteric vein. This one is splenic vein. This one is a gastric vein. So all the veins that joins together to form a one common port will be called as portal vein. That will gives up 75%. Okay, 75% of blood circulation is given to this largest organ called liver. Okay, about 1.5 kg. Clear? Yes, 1.5 kg of the this one liver. Okay, it will carry, it will having about 2.5% of the body weight. Okay, it is having the 2.5% of body weight. Now, so we will discuss that theory portion in the theory video. Okay, this is about the diagram. Now, so I am writing this one gallbladder. Okay, this is the gallbladder. For understanding about the biliary tree, I will take this gallbladder to be this side. Okay, so this is the what? Gallbladder. Clear? So what is this? This is the cystic duct. Clear? Cystic duct, neck of the gallbladder, and this is the body of the gallbladder. Okay, so now we need to understand in the liver, we are having the hepatic lobules which are present six sided. Okay, so I will write like here. Okay, this is the one hepatic lobule, another hepatic lobule. Okay, so there is another hepatic lobule. Like this, hepatic lobules are there in the where, in the liver. In the hepatic lobules, you are get to know, you are having the cells called hepatic cells. What is this? These are the hepatic cells. Clear? Okay, so like this it will be there, hepatic cells. From this we are giving, just understand, we are giving what we are giving means the blood, the supply, the hepatic artery is giving the blood 25%. Where is the other 75%? Then okay, then portal circulation is giving 75%. Clear? Portal circulation is giving 75%. Not only this lobe, right lobe, but also giving to the left lobe also, so that it will be divided as left portal vein, right portal vein, and this one is also divided as left hepatic artery and right hepatic artery. Okay, now so very importantly we need to know about the this bile duct. Okay, now so another the channel, another the vessel will be there, another the duct is there, which doesn't carry the blood but it carries the bile, where it is secreted by the hepatocytes, hepatic cells. Hepatic means liver. Okay, liver cells, hepatic cells, the liver cells. Clear? So hepatic cells, or we can call it as hepatocytes, which secretes the bile. It is the function of the hepatocyte to produce the bile, so that will be produced and secreted in the bile channel or canaliculi, and that bile canaliculi, it is coming from the hepatocytes, not going towards the hepatocytes. Clear? So that all the blood, okay, the blood is giving to the liver, bile is taken from the liver. Clear? So blood is given to the liver, bile is taken from the liver. Okay, now here I am taking the, that means from the here. Okay, I have taken the left hepatic duct and I have taken the, like this, hepatic lobules are present here also. Clear? I am taking the right hepatic duct from here also, and I am joining it to make a common duct called common hepatic duct. What I said? Common hepatic duct. And the beautiful thing is that this common hepatic duct will joins to the next cystic duct. Okay, what happens here? It will joins to the next cystic duct of the gallbladder. Okay, and it made another common duct, isn't it? This common duct is nothing but common bile duct. See, I will explain once again. Okay, this is for better understanding for you. Okay, yes, here this one is what? This one is the common, sorry, this one is the left hepatic duct. What is this? Left hepatic duct. This one is the right hepatic duct. It will become what? Joins together to become a common hepatic duct. Okay, later on, this is the cystic duct. Okay, I will write the names afterwards. First you understand. Cystic duct, common hepatic duct and cystic duct joins together to form a common bile duct. Is that clear? Okay, now it's a very important to know after this what happens here from the pancreas. Okay, this is called pancreatic duct. What it is? Pancreatic duct. I am writing it as a pancreatic duct. Later on it will become what? It will become a common channel. It will become what? Common channel. Okay, this one has become a common channel now. This common bile duct and pancreatic duct become common. So this common will be called as common hepato from the liver, hepato from the pancreas, pancreatic, common hepatopancreatic duct. Clear what is a common hepatopancreatic duct? Next, there is a small congestion, or we can call it as a valves. Okay, there is a valve or a congestion or a sphincter. That sphincter name is nothing but ampulla of water. What do you call ampulla of water? Clear? Okay. So now we will draw here. We will draw the pancreas. Okay, very importantly. Okay, now this is the pancreas. Later on we need to know where the exactly it will drains. See, pancreatic duct gives the pancreatic enzymes, common bile duct gives the bile because it is secreted from the liver, from the left hepatic duct, right hepatic duct, common hepatic duct, cystic duct, and it will use the common bile duct. And this one is having bile, and this one is having enzymes, pancreatic enzymes. Okay, so pancreatic enzymes, it is given to the duodenum, and bile juice also given to the duodenum. Clear? So here I am writing the duodenum. Of course, duodenum is back side, and this one common bile duct is front side. Clear? So clear, this is the duodenum. Now we will mention the one by one the names. Clear? So what is the name of this ligament? Sorry, this one is the diaphragm. Okay, so one, that is diaphragm. Very importantly, you need to look for the spelling. Clear? So here this side, which is present like a triangular, okay, left triangular, this one is the right triangular, but this one which is having like a crown, so that's why it is called coronary ligament, and it is attaching the inferior border of the liver to the upper surface of the or bare area. Bare area means you will understand when you look the liver in a posterior aspect. Okay, so there is a bare area. So the simply bare area means it is not needed, but for the diagram, but it is needed for the theory. Just understand, bare area means it is without peritoneal covering, directly attached to the inferior diaphragm. So that one will be said as bare area. So that bare area also having the coronary ligament, and this one, the triangular. Okay, the triangular ligament, this one will be called as left triangular ligament. This one is right triangular ligament, and this one is coronary ligament. Clear? So I will mention this is the 2, this is the 3, and this is the 4. Okay, so second one is the coronary ligament. Coronary ligament. Okay, third one is the left triangular ligament. Okay, fourth one is the right triangular ligament. Okay, fifth one is the right lobe. Sixth one is the left lobe of the liver. Okay, right, and sixth one is right. Fifth and sixth is right and left lobe of the liver. Okay, next this one This one is the left hepatic duct. Clear? Left hepatic duct. Mention the names correctly, then only you will get the marks. Okay. 8th one, right hepatic duct. Okay. This one, 9th, common hepatic duct. Okay. Excuse me. Common hepatic duct. 10th one. Which is the 10th one? Okay, this one, 10th one. That is the cystic duct. Cystic duct. Clear? Okay. So 10th one. This one is the 11th one. So 11th one I will write this side. That is the common bile duct. Common bile duct. Okay. So 12th one, I will write this one 12th as, okay, 12th one is a portal vein. Okay. So this one is the 13th. 13th is the hepatic artery. What it is? Hepatic artery. Clear? Still anything left? Okay, this one is the 14th. Okay, this duct, that is nothing but what? Common hepatopancreatic duct. Okay. 15th, this one. Okay, 15th is the ampulla of water. Okay, ampulla of water. Did I miss anything? Okay, this one is the gallbladder, isn't it? What is this? This one is the gallbladder. 16th. Okay, gallbladder. This one is the pancreas. So we will do that another video for the pancreas. And this one is the duodenum. What is this? Duodenum. About 17-18 points I said here. So in the back side of the liver you are having another lobes, smaller lobes. These two are the bigger lobes, left lobe and right lobe. Which is the big one in these two? That is right lobe. In the posterior aspect we are having the two smaller lobes. One is caudate lobe and another one is quadrate lobe. Okay, caudate. Okay, I will write here quadrate and caudate. Okay, quadrate and caudate. This is the lobe I am saying. Okay, this is the lobe. Clear? Okay, quadrate and caudate. Quadrate is the inferior lobe, caudate is the superior lobe. Okay, so this caudate hugs the or holds the inferior vena cava. This quadrate hugs the or holds the gallbladder. Okay, it will holds the gallbladder. This caudate holds the inferior vena cava. So I forgot to write here, that is inferior vena cava. This is the inferior vena cava, where in the posterior aspect, so caudate lobe is there, that will holds the like this, it will holds the inferior vena cava like this. Okay, and another one for the gallbladder, it will holds like this. Okay, it will holds like this, that is This is the quadrate and this is the caudate. Caudate, one which holds my hand is caudate. Okay, this one is quadrate. Okay, do you understood? So this is all about the liver. So I hope you understood each and everything how to write. Okay, and in the next class we will discuss the microscopic structure or histology of the liver, which is very important for the SEM exam. And this one, when they ask for 10 mark, you can write all the labels. If they ask 5 mark also, you can write all these things. So 10 points is enough for the 10 points is enough for the 5 mark. But if they ask 10 mark about explain in detail about the liver anatomy, if they ask like that, you need to write every points and you need to explain everything, how the portal veins come from and what is the exact location of the liver, that is right upper quadrant. Okay, for the quadrants, what is the exact location, why it is called quadrant, for that also we will do the another special video for that. So thank you for listening the class. Hope you are understanding and hope you are reading well. Read well daily. I am uploading it daily. Okay, thank you.